You may have to pre-book time-limited gym visits. Be prepared to be screened for illness prior to entry. This may include temperature checks and questions about your health. All gym goers must ensure they maintain 6 feet 2 meters distance between themselves and others. A mask should not be worn during gym activities of high exertion. However, for lower intensity activities, you may wear a mask as long as it can be tolerated. If you are struggling to breathe, feeling faint or dizzy, or experiencing chest pain or other discomfort, you should remove the mask. You must always wash your hands with soap and water for at least 20 seconds or use hand sanitizer on entering the building at regular intervals and after using equipment. If it is necessary to cough or sneeze, you should do this into a clean tissue which is safely discarded or into your elbow. Please note that personal towels should not be used to wipe gym equipment. Single-use paper towels or wipes should be provided to you by the gym, which can then be properly disposed. Sweat-absorbing equipment such as yoga or exercise mats should not be shared. Customers should bring their own if required for their exercise. Water fountains, unless hands-free bottle filling, are not allowed, so you should bring your own pre-filled drinks or water bottles. In the event group exercise classes are held, it is best if they are conducted outdoors. Such classes may only take place if they can be completed in accordance with the following. More than 6 feet 2 meters of distance maintained between participants at all times. No shared equipment during the class. Martial arts and other contact activities should be completed without any person-to-person contact. Limitations on group sizes should be adhered to. The current maximum is 20 persons. Please do not arrive more than 10 minutes prior to class in order to minimize socializing with your fellow gym goers. It may seem like a lot to remember, but specific instruction should be given to you by your gym before you even enter the facility so that you are aware of its expectations and requirements. Detailed directions for gyms, exercise facilities, health clubs, and dance studios can be found on the government website coronavirus.gov.bn.
Good afternoon, Bermuda, and thank you for joining us. As a country, we have made excellent progress, and Bermuda is being recognized for our collective progress in successfully navigating the COVID-19 pandemic. From an overwhelming majority of us working together and following the public health advice, we remain on pace to enter phase 4 of the country's reopening when the state of emergency expires on Wednesday, the 1st of July. Today, I am joined by the Minister of Health, Kim Wilson, the Minister for Public Works, Lieutenant Colonel David Birch, the Minister for Tourism and Transport, Zane De Silva, and the Minister of National Security, Minister Wayne Keynes. The focus of today's briefing will be on outlining measures as we move into phase 4, our new normal. There has been a lot of work getting us to this point, and before the Minister of Health gives her update from her ministry, I would like to pay tribute to all of our public officers, healthcare workers, volunteers, essential services workers, and all of you for doing your part to get us where we are today. Thank you. Minister Wilson will now give an update from the Ministry of Health. Minister.
Thank you. Good afternoon, everyone. Today, there were 220 test results received by the Ministry of Health, and none were positive for COVID-19. Bermuda has 146 total confirmed positive cases. Their status is as follows. There are now just 4 active cases, of which 3 are under active public health monitoring, and 1 is in hospital. None are in critical care. A total of 133 have recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 60, and the age range of all of our positive cases is from 18 to 101 years. Overall, 57% of all cases are Black, 40% are white, and 3% are other or unknown. The source of all local cases is as follows: 42 are imported, 85 are local transmission with known contact, 13 are local transmission with an unknown contact, and 6 are under investigation. So far, Bermuda has conducted 10,634 COVID-19 tests, and over 98% have returned negative. This is really good news for all of us, and it is reflective of our adherence to the rules when it comes to the preventative measures that we've spoken about over and over again, but they're important and they warrant repeating, such as mask wearing, physical distancing, staying home when you are sick, avoiding large gatherings, limiting our social interactions, and shielding our vulnerable, none of which should be abandoned as we prepare to enter into phase 4. On that last point, I just want to say that continuing to shield persons who are clinically extremely vulnerable and very elderly persons will be more important than ever now that we enter into phase 4. Such individuals must be shielded not just from the public, but also from household members who go out into the public. For instance, if you are a family member who is the caregiver of a vulnerable person, you must take strict precautions when providing hands-on care to that shielded person if you go out to do shopping or run errands, etc. You should wear a mask and stay 6 feet away from that shielded individual where possible. And if you must do hands-on care, please review the guidance for caregivers outlining the precautions that you should take, and they can be found at coronavirus.gov.bm. The specific shielding measures that vulnerable individuals should follow can also be found at that same website, and it includes avoiding close face-to-face contact with others, avoiding contact with someone who is displaying symptoms of coronavirus, and not attending any gatherings. I want to be clear, moving to phase 4 does not mean that everything is okay. We are reopening for the sake of our own mental well-being and our economic survival. We are not reopening because there is no longer a threat to COVID-19. We are able to reopen because we have done so well as a community in containing COVID that we have proven that we have the ability to practice responsible preventative measures. So please use caution over the next few weeks. And if you are in doubt over whether you should or should not do something, then just don't do it. You can also always call the COVID-19 hotline at 444-2498 for advice. As of July 1st, government will no longer require incoming travelers to self-quarantine for 14 days. We will, however, require pre-boarding testing, testing on arrival, and intermittent testing during your stay in Bermuda with public health measures. I will now detail some of the specifics around the testing of incoming travelers. Before leaving their place of origin, travelers should pack a thermometer so that they can self-monitor as per public health supervision once they arrive. Visitors should show proof of a negative PCR COVID result from a sample obtained ideally 72 hours prior to travel in order to board, or up to 5 days is also acceptable. This can be a written lab result from a verifiable lab or physician. Negative tests should be verified through an online travel authorization process that will go live next week. Residents and visitors unable to have access to a pre-departure test can test on arrival, quarantine for 3 days, and then test on day 3 to allow for the equivalence of the 72-hour pre-boarding clearance that I just spoke about. Visitors and residents must all be tested on arrival at the airport and quarantine at their accommodation until a negative real-time PCR test result is received. A nasopharyngeal test is required for adults. Children aged 10 to 17 will likely be able to take the saliva test, and children under 10 will not be tested. Test results are expected within 8 to 24 hours, depending on arrival time. If a negative result is obtained, Those with the pre-boarding clearance may circulate freely amongst the community. Travelers, like residents, will be required to wear masks in all public places and follow physical distancing guidelines. All visitors and returning residents will be under public health supervision during the first 14 days of their stay and will have to complete a very short online health self-report daily, including their temperatures. A COVID test will be required on set days, and their health status must be reported to public health officers. These set days are on day 3, day 7, and day 14. Travelers will be mandated to be accessible by phone, email, text, and a physical address in order to communicate with a health officer. A traveler will only be fully cleared after receiving a day 14 negative test. If a traveler becomes COVID positive or symptomatic or is in close contact of a positive person, they will be quarantined or isolated as appropriate. Any traveler who does not wish to be subjected to the required testing will have to quarantine for 14 days and either A, have the day 14 clearance test, or B, quarantine for a further 14 days with no clearance test. As I close, I want to remind the public of the COVID-19 pop-up testing that's taking place around the island this weekend. Tomorrow, June 26th, testing will take place from 9 a.m. until 1 p.m. at the Hamilton Cathedral and at the Somerset Marketplace from 3 p.m. until 7 p.m. And on Saturday, June 27th, testing will be held at the Southside Testing Facility from 9 a.m. until 1 p.m. Then on Sunday, June 28th, testing will be held at the Modern Mart from 12 p.m. until 5 p.m. and also at the Southside Testing Facility from 9 a.m. to 1 p.m. In order to ensure that wait times at the pop-up testing venues are as minimal as possible, again, I strongly encourage residents wishing to get tested to please ideally book an appointment in advance. This makes it much faster and more convenient for you. You can book online via the government website at coronavirus.gov.bm or call the COVID-19 hotline at 444-2498 between the hours of 9 a.m. and 9 p.m. to make a reservation. A full schedule of testing days and times has been posted to the government website. And again, for more information about pop-up testing, you can call 444-2498. Thank you, Bermuda, and please remember to wear your mask as well as to keep 6 feet apart from persons if you're not wearing one. Thank you, Premier.
Thank you very much, Minister of Health. And that is great news to know that we had so many test results back today and none of them were positive. Your team continues to do great work in the community. I want to thank and pay tribute to the entire staff at the Ministry of Health. Now we will have an update from Minister Birch, who is the chair of the Cabinet Committee for Reopening of the Economy, on the details surrounding the start of Phase 4, our new normal, on July 1st. Minister Birch.
Thank you, Premier. Good evening. You will recall from Monday's press conference that the Cabinet Subcommittee on the Strategic Reopening of Bermuda was to present to Cabinet on Tuesday last recommendations for the traveler entry policy to be applied on the resumption of scheduled commercial flights into Bermuda. That will be covered by Minister De Silva, and the recommended matters for Phase 4 of the reopening of Bermuda. I wish to remind that Phase 4 will commence next Wednesday, July 1st at 6 a.m. So we are still in Phase 3. Until then, but we are providing advance notice so that affected parties can plan ahead. Phase 4 will consist of the following. The state of emergency will end at midnight on June 30th. Permitted gatherings will increase to a maximum of 50 persons. Requests for larger gatherings must apply to the Minister of National Security for permission, with a plan to include social distancing and masks. Masks must be worn indoors. Masks must be worn outdoors if physical distancing cannot be maintained. Recreational scuba diving will be permitted in Phase 4, and subject to public health guidelines, nightclubs and bars will be allowed to reopen. Early communion in churches will be permitted. Temperature taking as a precondition of entry into government buildings will end. However, masks and hand sanitizing is still required. The government quarantine site will close on June 30th. Since we have started a trend of having sub-phases, we have two items that will likely form a phase 4B. They are subject to successful discussions with grocery stores to retain 2 or 3 discount days, alphabetized shopping will end. And the curfew will shift effective July 1st to 12 midnight in the evenings until 5 a.m. in the morning, and will be reviewed weekly going forward. While we as a country have made enormous progress, the committee is mindful of mitigating the risk and recognize that we still have to be cautious and follow the health protocols that have gotten us to this point. Thank you.
Thank you, Colonel Birch, for that update. With the hospitality industry hardest hit by the shutdown, Phase 4 will provide hope to our hospitality workers and industry that there will be some activity in 2020. Tourism is vital to our economy, given the employment that it provides. Minister De Silva will now detail the extensive and rigorous protective measures that we are confident will keep Bermuda and our visitors safe. Minister De Silva.
Thank you, Premier. Good evening, everyone. I know many Bermudians are keen to stretch their legs beyond our shores, just as many who are abroad are anxious to return. I am pleased that the Ministry of Health and my ministry have been able to work together to produce a set of travelers' guidelines which keep our visitors and our residents safe. After all, our island home is a precious resource, and we need to ensure our community is protected as we look forward to welcoming residents home and inviting visitors to experience our jewel in the Atlantic. When regularly scheduled commercial flights resume in July, we anticipate Air Canada, Delta Airlines, and British Airways to service our island. These schedules are always subject to change, but at present, the flights are as follows. From Thursday, 2nd of July, Air Canada will fly weekly from Toronto. Starting Monday, the 6th of July, Delta will fly daily from Atlanta. And beginning Friday, 17th of July, British Airways will fly twice a week on Mondays and Fridays. Delta's flights from New York and Boston are on hold. JetBlue anticipates providing service from those two cities starting in August, while American Airlines will fly from New York. The other air service that we believe will start in August is WestJet, also from Toronto. Flights from Philadelphia and Miami on American will not begin until later this year. What we refer to as seasonal flights from Newark, Washington, D.C., and Charlotte are canceled for 2020. Where does this leave us? The percentage change in our air capacity, i.e. available seats year over year, is as follows. When we restricted entry only to Bermuda residents in March, that led to a 45.6 reduction in air capacity. In April, May, and June, we experienced a 100% reduction in air capacity as no commercial flights landed. And for July through to December, we anticipate a reduction in seats available of between 91.9% in July and 26% in December. On average, as a result of the pandemic, Bermuda will experience a 61.7% reduction in air capacity in 2020 when compared to 2019. What does that look like in numbers? In 2019, our air capacity amounted to 579,000 seats, and in the 2020 projection was 543,000 seats. Now, we project a total for 2020 of 222,000 available seats. That is approximately 358,000 fewer seats for travelers than last year. I must emphasize, these schedules change regularly and sometimes even daily. So we will continue to monitor seat availability as when schedules change and adjust. Working with the Bermuda Tourism Authority, Bermuda Airport Authority, and Skyport, The Ministry of Tourism and Transport will seek to increase air capacity and encourage visitation as vigorous as we possibly can. Our economy depends on it. As I stated in the beginning, the Bermuda government has placed great emphasis on community safety and creating an island space where visitors will be able to come and relax. We must do our part to ensure that as we progress into phase 4, we continue to embrace all the health measures that benefit us all. Keep your distance and wear your mask. Thank you.
Thank you, Minister De Silva. As we make decisions like the reopening of the L.F. Wade International Airport, the public should know that safety is first and foremost in our minds. The high degree of screening and the protective measures we have identified are not just about keeping you safe, but we're also shaped with the understanding that we have skin in the game as well. Getting this wrong puts the entire country at risk, and that is the reason why we are making sure that we get it right the first time. There are many who believe that we should keep our borders closed. I understand the fears that persons may have as they see the news on how some countries have not managed to handle their outbreaks. What is important to know is that Bermuda is as safe as we are due to the wide-scale testing that we've engaged in, and we will ensure that that is applied to our visitors who will be required to be tested as well prior to departure, upon departure, and during their time here on island. Bermuda's regime will likely be the strictest in the world, but visitors want a safe place to visit, and that is what Bermuda will be, that safe place. I now invite Minister Wayne Keynes to give an update on the Ministry of National Security's plans as we move into phase 4, our new normal. Minister Keynes.
Thank you, Premier. Good evening, Bermuda. First, allow me to express my thanks and appreciation to all of our essential workers, the Disaster Risk Reduction and Mitigation Team, and all of the Ministry of National Security's uniformed personnel who have braved the front line over the last 4 months of the COVID-19 pandemic to ensure the people of this country were kept safe. You are the huge reason why we're on track to move into phase 4 in a relatively good state. We all owe you a tremendous debt of gratitude for your service and your commitment to Bermuda and her people. Bermuda, as we move into phase 4, here are a few key points for the community to be aware of. We recognize that our beaches, parks, and surrounding waters will continue to see increased usage as the summer progresses. And as we navigate towards lifting the state of emergency on June 30th, it is critical that we remain vigilant as a community by following the safety guidelines put in place by the Ministry of Health. Now that phase 4 allows gatherings of up to 50 persons, we recognize that there are some members of the public who will wish to host events or gatherings of more than 50 people. However, I must caution that any gathering of 50 or more people will have to have the permission of the Minister of National Security. In that regard, an application must be made seeking approval. To assist the public, gatherings of over 50 people will be available on the government's website. However, the general process, once the application is made, is as follows. Event organizers, this includes planners and promoters for larger functions such as concerts, they will have to submit an event safety plan taking the guidance into consideration when planning their event. A form will be made available on www.gov.bm for persons to apply for permission to hold an event for more than 50 people. Guidance surrounding this will be included on the form. The Disaster Risk Reduction and Mitigation Team will consult and review the applications with the Ministry of Health and other agencies. If permitted, the DERM team will issue an approval letter outlining the health and safety conditions for hosting the event. A copy of the approval letters will be sent to the Bermuda Police Service. To ensure that we provide the clearest possible guidance and advice to the event planners and promoters of the large-scale events, the Ministry of National Security will host a meeting at a date and location to be announced at a future time. Anyone wishing to attend this meeting should email emogroup@gov.bm and include in the subject line promoters and event planners meeting. Turning to the Bermuda Police Service and the Royal Bermuda Regiment. The Bermuda Police Service and the Bermuda Regiment continue to work in partnership to ensure adherence to the COVID-19 regulations. On land, the compliance has been positive. However, there were 19 curfew breaches on the water last weekend, with boaters ignoring the 10 p.m. curfew and having to be directed into shore. This weekend, law enforcement action will be taken for those who fail to comply with the marine curfew. The Bermuda Police Service will place additional resources this weekend in locations where disorder has taken place in previous weekends. The Bermuda Police Service continues to investigate the recent incidents of violence, including the murder of 22-year-old Joshua Rouse. Please note that 4 men believed to be involved in the incident were arrested and are now on police bail. Inquiries continue, and the case continues to get the support. The Bermuda Police Service continues to provide support to the family of Mr. Rouse. It is now believed that all recent incidents, including the murder of Mr. Rouse, the attack on the female with a machete, are all connected. There have been further arrests, but inquiries continue. The Bermuda Police Service can thank the community for the information that they have provided to assist in the aforementioned investigations. Please note that in the coming days, targeted patrols have been placed in the area of Warwick to reassure the public and to respond quickly to any incident. Intelligence is being used in order to deter and prevent future gang retaliation. Last night, there was a disturbance at Chaplain Bay involving youth fighting with helmets and knives. When the police arrived, the crowd dispersed. One man attended the King Edward Memorial Hospital with a stab wound to his arm and was later arrested. Please note that inquiries with reference to that matter are ongoing. The Bermuda Police Service continue to search for Ms. Chevelle Dill Burgess, and inquiries are ongoing. As a reminder, there is a $50,000 reward being offered for any person who can assist the Bermuda Police Service to locate Chevelle. After a nearly 4-month embodiment period, the Royal Bermuda Regiment provided and maintained an invaluable service. Over the next few days, the Coast Guard will continue to enforce Bermuda's maritime laws and COVID regulations. Again, this is my familiar refrain. Raft ups are still prohibited, and the limit is 20 persons for recreational boats. All commercial boats are allowed as many persons as the license allows, as long as they maintain the appropriate physical distancing. I would like to clarify that this weekend is still phase 3. So even though we are announcing phase 4, it is important to note that the new guidelines for phase 4 do not go into effect until next week, Wednesday. Existing rules for phase 3 remain in effect for this weekend. As I close, I wish to share some key Coast Guard summary points. The Coast Guard have been in operation for 84 days continually. There have been 7 Coast Guard vessels in use. There were 343 operations conducted from the Coast Guard headquarters, which is Watford House. There is an average of 4 patrols per day. There were 4,206 instances of engagement with other watercraft. The Coast Guard issued 173 warnings. They served 33 summons, assisted with 8 arrests, and have issued 38 tickets. They have conducted 6 search and rescues and more than 24 tows, and participated in 1 joint exercise with the British Royal Navy. Thank you, Premier.
Thank you very much, Minister Keynes. For those of you watching at home who may see the big smile on Minister De Silva's face, it is due to the fact that his beloved Liverpool has finally won their first Premier League title. So very... As we have heard, The government is working to make sure our island stays safe as we fully open our economy. I am confident about our ability to move our economy forward as we resume our normal activities. Those of you who may be hesitant to return to work, to venture out to shops and restaurants, you can do so knowing the precautions you must take personally, while large and small businesses, retail establishments, restaurants, and other businesses know what they must do to maintain a safe environment. During my quarterly meeting with the Chamber of Commerce, I reiterated my position that Bermuda has faced the COVID crisis head on. Guided by the Ministry of Health, we have put in appropriate measures to ensure that we can continue. I encourage everyone in Bermuda to follow the guidelines and confidently return to your place of work, engage in leisure activities, visit retail establishments, go to lunch, dinner, buy breakfast, patronize small businesses, and even feel free to socialize after work. Take advantage of the staycation offers available from our hotels, and feel free to make sure that you support our local economy. We have supported each other in the last 3 months, and now is the time to continue to support each other as we move towards our new normal. While we continue to live our lives, it is important that we pay close attention to what we have learned over the past few months. As long as Bermuda follows the public health guidelines, and as long as we continue to wear our masks, despite what you may see on YouTube about the fact that it may not be healthy, it is important to make sure that it is done to reduce any possible spread of this virus. From the start, we have been determined to prevent the economic impact of COVID-19 from being worse than the virus itself. And it's critically important that all of us continue to do our part. As we conclude our briefing today and take questions from the members of the media that are here today, I would like to take a moment to reflect on how far we have come and how much we as a people have overcome. With no tried and tested global template to follow and no proven pathway to success to emulate, Bermuda has demonstrated creativity, resilience, and discipline. We have truly punched above our weight in terms of managing a crisis that many larger jurisdictions have mishandled. Now is not the time to get complacent, and now is not the time to sit on our laurels. As we prepare to move into phase 4 next week, let us continue to do what we have done that has made us successful, and together as a country, I am certain we will succeed. With that, I'm happy to take questions from members of the media.
Thank you very much, everyone. Good evening. Fiona McWhirter from the Royal Gazette. Minister of Health, I think you said that children under the age of 10 won't be required to take a test. Can you just give us the reasoning behind that, please?
That's correct. Children under the age of 10 will not be required to take a test. So far, the evidence suggests that those persons, children under the age of 10, are less likely to transmit the virus.
Understood. Appreciate that. Thank you very much. Minister of National Security, I understand that the Cedar Bridge shelter continues while we still have our curfew hours. Will that continue while the curfew is in place? And are there any, plans to support those individuals once the curfew ends?
The shelter will remain in place as long as the curfew is in place. It is our goal to work with other agencies, both private and public, to ensure that we have a transition program in place for all of those that are guests at our shelter. So that after the shelter closed, they can transition into another phase of their existence.
Appreciate that. Thank you very much. And with regards to, we hear that there's some discussions with regards to an air bridge or travel corridor between certain countries, with the UK, Bermuda being one of them, which I think would mean that travellers from here may not need to quarantine upon arrival in the UK. Can anyone tell us anything about any discussions there?
I can inform persons that I don't think that those discussions have reached any level of an advanced stage. There has been some communications with Government House regarding that, and I know that a number of the overseas territories, including Bermuda, have written to the Foreign and Commonwealth Office on those issues. We have not received a positive response to date, We understand that the United Kingdom government may be making an announcement. There were some media reports that stated that the overseas territories would not be included in the requirement for persons to quarantine upon their return from a vacation, but we're looking to see clarity on that. I think that from Bermuda's perspective, the work of which we have done in this country, the fact that we have been upgraded to our status to sporadic cases, we only have 4 active cases, and we're continuing to test aggressively and make sure we do the work which is required to protect our economy. I think that we should be ideally placed, certainly managing the pandemic better than other countries, which the United Kingdom may allow to people to travel and return back to their country without quarantining for those 14 days. So we will continue to make those representations, but we have no confirmation of the United Kingdom government action at this point in time.
Appreciate that. Thank you very much. Minister of National Security, you mentioned the search for Chevelle Dillon Burgess. Don't know whether or it's yourself or maybe Commissioner of Police. Is it possible to say how many contacts or communications have been made since the announcement of that reward last week?
If you don't mind, I'll have the Commissioner of Police is with us. I'll have him address that question.
Thank you.
Hello, Fiona. Was it how many contacts we've had in regards to the reward?
Yeah, since that reward was announced last week.
Yeah, there has been 0 contact, but we made specific that we want to hear from a personal persons who have direct knowledge as to where Chevelle is, so we can find her on behalf of her family. So we are still awaiting to have a call, and I appeal to anybody who does know any information to contact the 2 numbers published as soon as possible.
Thank you. And perhaps for yourself as well, the Minister mentioned that several of the recent violent incidents have been connected. I think the Minister mentioned the machete attack and the incident at the Rubis gas station in Warwick. Can you tell us if the shooting in St George's was one of those ones that was connected to those other 2 incidents?
Yeah, I don't want to go specifically into the investigations per se, Fiona, because they're ongoing. We have parties arrested for all the incidents, but we do believe there's a connectivity throughout all matters that have taken place over the past couple of weeks.
Thank you very much. Appreciate that.
Good evening, everyone. Maya Palacio here for Media Maya. On Monday, I asked Mr. Alderley if Skyport will require the government to pay the minimum revenue guarantee. I did have a follow-up, and my follow-up was, how much is the minimum revenue guarantee, if anyone knows?
At this stage, there is none, because we haven't reached that point in discussions.
Thank you very much.
Mhm.
My next question, since the gatherings have extended to 50 persons maximum, question from the community is, will camp numbers be able to extend?
Are you talking about
The
people, children?
No. That's for mass. That's for Minister Keynes was referring to mass gatherings over 50, but with respect to camps, the parameters are outlined for public health reasons on the government website, and it speaks specifically to the requirement of physical distancing. So that would certainly not increase, of course, unless the facilities that the camps were offered in, the sizes increase. So the main parameter is with respect to the requirement of physical distancing. So the space is what dictates how many children can be in one particular camp.
Thank you. Is Workforce Development still offering internships for college students?
The answer to that question is yes.
Thank you. And would anyone know when the Workforce and Development will be able to get back to some students who may have applied in like January and still waiting to hear?
That I can't speak to. I would assume that most students have been responded to, so I'm happy to ask the minister to follow up. But I do know that an intern through the Department of Workforce Development, who is a college student, started in my office this week. So I know that program is going on. Oh, and there's 2 behind as well.
Awesome. And my final question actually comes from a community member. It's fairly lengthy, so I apologize, but it's about their relative. He is over 65 and is still working. Therefore, the 2 pensions he has, he cannot draw from, even though he is out of work, just like everyone else. Because he is already past 65 and works, it doesn't allow him to receive any money from his pension. But he is still expected to pay mortgage on his properties, yet his tenants can't pay because they are also out of work. Trying to understand what a person in his situation would do.
Osio. I would say a little bit confused because one part of the question said the person was unemployed and the next part said that the person was working. Nonetheless, when the Minister of Finance was here last week, I think that he clarified the changes which were being made to the pension legislation, which was passed through the House of Assembly on Friday and probably passed by the Senate yesterday, which said just because you're 65 should not or disqualify you from this benefit. So those modifications were made. So I believe that that issue that you referred to has been fixed. But that person is welcome to write directly to my office, or actually that person could write directly to the Minister of Finance's office, because as he announced when he was there last time, he has his own email address. Can ease up my email address a little bit, and it's ministeroffinance@gov.bm. But I do believe that the situation regarding the disparity between those over 65 and under 65 has been addressed.
Thank you. Those are my questions.
Good evening, Don Burgess, Bermuda Broadcasting. Health Minister, you mentioned that when tourists arrive on the island, they will have to report to a public health officer every 3 days. Where will this public health officer be located, and how much will tourists be charged?
I'm not. Let me just clarify something, because you've asked a couple of questions and it's not exactly accurate. The public health officer is the public health supervision. So when a person arrives in Bermuda and whilst they're waiting for their test or in the interim period, they have what's called public health supervision, which is effectively where they'll be contacted to make sure that they're checking their temperatures regularly, asking questions as to whether or not they're exhibiting any symptoms and so forth. With respect to the testing, we indicated that you would be required to be tested on day 3, 4 days after that, and then 7 days after that. So effectively, if you were going to be here for a period of 14 days, then you would have potentially 2 pre-clearance tests, one within 72 hours prior to boarding, one upon arrival to Bermuda, the next one 3 days later, the next one 4 days after that, 3 days, and then 7 days later. So a total of 5 tests if you were going to be here for that 14-day period. And the pop-up testing facility will be located likely at the cathedral, so we'll have a central location. So when persons are required to get those tests on those intermittent days that I mentioned, then they'll be able to go to that. But all that information will be provided to them in advance, and it will be part of the public health screening to let them know where do they go tomorrow to take their test.
And just to follow that up, how much will they be charged for each test?
The pre-clearance at this point, when persons arrive, they have to, prior to their arrival, they have to complete a travel authorization form, and that includes a lot of information that's being requested of them, but it also includes the payment of $75, which should cover the cost of the testing facilities here in Bermuda.
Thank you very much. New COVID-19 infections are skyrocketing in parts of the U.S. As a direct result of this explosion in new cases, the European Union is considering banning travelers arriving from the United States. This is a lead news story around the world today. How concerned is the Bermuda government about the spikes in the U.S. cases and the potential exposure this creates for Bermuda with our airport about to reopen?
My answer to that is, Don, is that I can understand that the European Union is not going to be able to require pre-arrival testing and having testing at their borders for all persons and strict requirements, including quarantine bracelets, which have arrived on island to ensure that we keep our country safe. So lots of other countries have lots of different requirements. Bermuda has its own unique requirements, and we are certain that the requirements that we've put in place will keep our country safe. The U.S. does have a big spike in the amount of persons that are contracting the virus for a number of reasons, but it should be noted that those are being driven by persons who are largely young people hanging out in South Beach and others. And the truth is that that's not Bermuda's demographic. We have a strict regime that's going to require pre-testing and those testing things that are there. And for persons who are looking to come to our shores, they have been the people who've communicated with the Tourism Authority and others. They've been the persons who have been quarantining in their homes, who've been keeping safe, and they're looking forward to getting their negative tests and coming to Bermuda. So we have our own requirements. Other countries can adopt theirs. We are confident that ours are going to be strict enough to prevent there to be case outbreaks in imported cases that are going to come here and manifest themselves and to lead to a degrading of our country's status.
If the airport reopens and new cases from hotspot countries and cities come in, is the government concerned that it could face civil lawsuits from citizens and their loved ones who are infected and in some cases die as a result of imported cases?
I would say the answer to that question is no.
Thank you. We are hearing from hotels, restaurants, and other businesses that recently a high number of work permits have been denied, and this is impacting their ability to reopen and do business. Can the government tell us which categories of permits are being denied the most and how many work permits have been approved or rejected of late?
I think that in answer to the question, the Minister of Labor gave a statement that would have answers to a lot of your questions on Friday in the House of Assembly when he spoke on what is taking place. What I can say is that the Ministry of Labor and the Minister responsible for Immigration, who is now Minister Jason Hayward, who used to be the Minister of National Security, are examining all items as they come forward. And some restaurants or some other persons who may not have had their work permits renewed have the ability to go ahead and appeal that decision if they think that it is going to hamper their business operations. But I think the Minister of Labor has made it clear that the government is going to make sure that we put Bermudians first. In a situation where we have a significant amount of Bermudians, especially persons that are working in the hospitality sector in large hotels that were not reopening, they can transfer their skills to other places. And we are going to encourage that. The Department of Workforce Development and the Ministry of Labor will continue to encourage that behavior. And so our view is that we have sufficient labor on island to make sure that those tasks are managed. And it's the responsibility of employers to make sure they work with the Department of Workforce Development and get those matters handled.
Thank you. Are we able to quickly track the virus in Bermuda through genomic epidemiology by looking at the phylogeny, the genomic family tree, when we do PCR testing to be able to determine where each infection comes from, and in order to have better, faster contact tracing? And if we can do this, what's the data on that?
That is clearly a technical question because you obviously had challenges saying some of the words. I'll get that information and get back to you.
Allow me to try and help just for a second, Don. I recognize the question of where you're trying to ask, and I think that actually Dr. Weldon addressed that when she was here a few, not weeks ago now, probably last month. What you're asking is the genetic sequencing of the actual coronavirus as the coronavirus, the novel coronavirus, can mutate. And one of the things which Dr. Weldon has said that she's going to be working on students with here in Bermuda is the actual sequencing of the virus. And so we can see the actual cases here on island. And as you said, I'm not going to try to pronounce the word, and to see how that sequences and where those virus strands may have come from. But the truth is that we have such a low amount of positive cases in the country that it is difficult. Now, in the future, that may change, but it is still the intention, as was laid out in the plans, to go ahead and start the genetic sequencing. And I think that Dr. Weldon says that it is nanopore sequencing that she uses in order to determine, and those are in wide databases. What is important, and for persons to know, that the public databases of virus and RNA items are all from the Bermuda Protocol, which was agreed in Bermuda in the 1990s. And so I think this is something that it's almost coming full circle, that we recognize that what has been able to be used to assist countries around the world in the sharing of genetic information regarding viruses and other things is because of a protocol that was agreed in Bermuda in the 90s. So I think that's certainly helpful to bring us full circle. But to answer your question, we will be doing that, and Dr. Weldon is committed to doing that through the Bermuda Government Molecular Diagnostics Laboratory.
All right, thank you.
Good evening. Can you confirm, can you clarify, with the state of emergency ending next Wednesday, will the curfew end with that as well?
The curfew will not end with the state of the emergency.
So what will be the stipulations for the curfew? Still 11 o'clock?
It was addressed. I'm happy to address that, Trevor. It was
Yes, sir.
addressed, I think, in Minister Birch's statement. However, it's also handed out in the document, which is handed out to all media. And I'll read from it. It says the curfew will be midnight until 5 a.m., and that curfew will be reviewed weekly.
Thank you much. Mr. Keynes, this one's for you. We're seeing a spike of violence and gang-related incidents in the Warwick area, Southampton area in the last 2 weeks. How will the police strategy change in combating this upswing in violence?
And the commissioner is here, and so I'll let him deal with the operational pieces. And just want to say, there has been an uptick in violence, and the people in Bermuda are concerned. We have had the opportunity to speak with His Excellency the Governor, the Police Commissioner. We had our briefing on Monday, and we put together what we believe is a robust plan for doing so. I met yesterday with Pastor Leroy Bean and the Gang Violence Reduction Team with our plan on how we will deal with this in our community. And so we have different elements that we believe coming together will be an effective plan to deal with this going forward. I must say, though, that we will not, as a country, descend into mayhem. As I spoke with the police, whilst we do not want the police to be heavily handed, we will meet this with the force necessary to protect the citizens of this country. We will not have the people in Warwick, from Khyber Pass and on Cedar Hill living in fear. And we know that we have to have a robust policing plan to deal with the antisocial behavior, and we're committed to keeping and preserving law and order in our country.
We've also seen, I don't know if the commissioner wants to add to that.
Please.
I think, Trevor, we covered it pretty much earlier, but just to say that we have increased patrols in the area. I'm extremely grateful to the local community who have provided us really valuable information, because they will not tolerate this kind of behaviour. And there's a lot of targeted activity. And I've said many times that the public will only see a part of what the police do. So there's a lot of intelligence work in regards to targeting those that present most risk. And indeed, in regards to the cases that have taken place recently, the one thing that should reassure the community is that they are interconnected. These aren't random attacks on people. These are between parties that know each other, and we have made numerous arrests to bring them into custody and control the situation. But equally, we can't be complacent, so we're placing patrols, we're doing a lot of proactive activity, and as the Minister's highlighted, we're taking a zero tolerance approach in regards to anybody that misbehaves or threatens violence.
Question, we've had 3 incidents. One was done at Clearwater, one at John Smith Bay, and then last night at Chaplain Bay. Young people, age bracket, as you know, a lot of alcohol being used. Has there been any thought, because the community, I've seen it on social media, the community is questioning, do you think it's time that we change the drinking age to either 21 or 25? Has there been discussion with the cabinet?
At this stage, the cabinet has not had discussions along those lines. But Trevor, we have to have an honest conversation about responsibility in our country and about our young people in this country. And that has to be the forefront of these discussions. Every one of the incidents that you have highlighted, there have been there have been people between the ages of 15 to 20 that have been out at these events. And each one of those people have people that are responsible for them. As a community, we have to look at this thing in a collaborative approach. The government will do its part, the Bermuda Police Service will do its part, and we're urging the community to do its part as well.
My next question, Premier. There have been calls pending investigation into corruption in the office of the DPP. If you're seeing an outcry of the incident from yesterday, will you be considering an investigation, an independent investigation into the office of the DPP?
Trevor, happy to remind you and everyone else that Bermuda is still a colony, and the Department of Public Prosecutions, just like the Bermuda Police Service, do not report to the government, they report to the governor. So your question would be most appropriately addressed to the governor, who has control of the appointment and management of the Department of Public Prosecutions.
Thank you, sir. I don't know who can take this question. The police have focused on standard accountability and discipline of officers with special officers officers to lead the charge. Several police officers have been recently put before the courts for dishonesty and drug-related offenses. Recently, 2 officers were accused of sexual assault on another police officer. We were informed that matters were not processed. The matters will not go before the courts, ordered by orders of the DPP. As the minister responsible, can this be an overturned? Can this situation be overturned? And who will be liable can this be overturned by your office or the governor?
Firstly, let me say, Trevor, we take all matters that abort to our ministry seriously. If this is indeed factual, we are concerned on a number of fronts, and we believe that any victim who's making a complaint should be supported. I'll have the police commissioner deal with that as well, but I would like to say that the matters were set out clearly on how to deal with such a matter in a case called the Middleton case. The only way to deal with a decision of the DPP with reference to the charge approval is by judicial review. So there's a clear legal process that is set out. That is, the Director of Public Prosecutions has a unique constitutional position. He answers to no one with reference to charging an individual. The only way to deal with that legally is through a matter of judicial review. So the parties involved, and I'm involved, that the victim in this matter has obtained legal counsel, and the legal counsel have a remedy that is open to them, and that is through judicial review.
Trevor, just to echo the minister's point, that is correct. The officer who reported this crime is seeking judicial review, and I think we need to let that due process take place. The 2 officers that were accused of the offence, both criminally and also in regards to conduct, remain suspended. As Commissioner of the BPS and with the support of the Minister, we take integrity and professionalism serious to the point where it is absolutely everything. And whilst it is a regrettable situation, we've seen a number of officers suspended and indeed dismissed from the service. We currently have 6 officers suspended and several on restricted duties. But it is essential that we gain the trust of the community, and when wrongdoing is identified, we deal with it properly. But there is due process, and some of the comments on social media have assumed some of the facts, and we must move through that process before we can make a determination as to what has actually happened.
Thank you. I've been told I have one question left. Thank you, Ms. Batamosi. Minister of Health, since we've started this whole press conference regime, the moonlighting, as you've identified for the nurses and nurses' aides, have been restricted. Can we see these nurses go back to their second jobs? Because from what I've been hearing, they're struggling to make ends meet. I know half a paycheck is better than no paycheck at all, but they are looking to, when will they be allowed to return back to their second place of employment?
These are conversations that the subcommittee, the opening subcommittee that's chaired by Minister Birch, continue to have. We recognize that there are some challenges with persons' inability to work multiple locations. However, on the flip side, we also recognize the issue concerning some of our most vulnerable residents are living in these seniors' homes and care facilities. So we have to strike a proper balance. And again, those are conversations that will be had, and we've got a meeting on Monday, and I'm sure it'll be discussed again. We also have to pause for a moment to see what, if any, impact of opening of the borders has on Bermuda next week. As the Premier indicated, we have a really good rating from the World Health Organization with respect to local transmission, sporadic cases, and we want to do our best to contain that. However, it is acknowledge that there are persons that are, for economic reasons, suffering because of their inability to work at multiple rest homes. However, we also must acknowledge that the majority of those persons that reside in those rest homes are extremely vulnerable. So we have to strike the right balance, and those discussions are ongoing with the subcommittee.
Good evening, panel. Premier Burt, if I could start with you, and I realize this may be a fait accompli, but with regards to the decision taken that restaurants with bars could open and bars that are not restaurants could not. And I realize that lifting is next week, but the perception within the Black bar ownership community is, what is the difference between eating inside of a restaurant and having a drink, particularly for those bars that don't have outside facilities?
Thank you for your question, Sheila. I addressed this when I spoke, I want to say 2 weeks ago,
I
and
heard
you would
you.
recognize that we did make certain changes.
And I heard your
especially-
apology for not having an answer last week. And
I guess if you're going to answer for me, I don't
no,
have
I
to answer.
just, in light of that, could you just tell me, because it lifts next week, but the perception is, I did a walk through Court Street and a number of Black bar areas, and they're still shut down. And you have people at certain establishments on Front Street drinking and eating corn kernels and not eating. So the question I've been asked to ask you is, what's the difference, and what was the thinking of that logic?
Is that your second question, Ms. Wilson?
No, that's the supplementary.
I'll count that as the second one, Ms. Wilson.
Okay, fine.
Here's what we'll say. We have opened up the restaurant industry. We've also allowed bars with outdoor facilities to open up, and bars will be able to open up in phase 4 for indoor service as well.
If clubs and bars are open and they're licensed to stay open to 3 a.m., you're saying the curfew is still at midnight?
The curfew is in effect at midnight, until 5 a.m., and that will be reviewed on a weekly basis. The Cabinet Committee took the decision that we should move slowly and not all the way, and so that is the decision of which has been made. So the curfew will take place between 12 a.m. and 5 a.m. What is important to note is that curfew falls under the Public Health Act, the Summary Offenses Act. There were recent modifications that were made to that. If there is a curfew to be ordered, it must have the approval of the Ministry of Health, and it also must have the concurrence. It is done by the governor, and the governor must consult the leader of the opposition and also myself. I consulted the leader of the opposition on Monday on this particular matter and also confirmed today he is in support of the position of which is laid out, and the government itself has made this decision to continue the curfew following phase 1 on a weekly basis to be reviewed. Ultimately, we'd like to move to a place where that curfew does not exist, but what is clear is that we have to continue to move slowly. And what we all know is that as the time gets later, people drink more, people do more, social distancing can fall apart, person become intoxicated, and we are trying to take this at a slow basis. So this is a decision which the government's made. Many persons may not agree with it, but we believe it is in the best interest of the country, and we want to keep our ratings as we go forward, so that's what we're going to do.
Coming soon, what's the point of having alphabetical shopping, particularly when there's no lines? You have some grocery stores enforcing it. Others, like the Shelley Bay Marketplace, are not. If you don't have photo ID, you can't shop. Does it make sense at this point?
I think it does, but Colonel, do you wish to address?
Initially, I was the only one for keeping it. I still am, because the grocery stores provide discount days on Monday, Tuesday, Wednesdays. And so everybody in the alphabet gets an opportunity to be able to purchase goods at discount. We expect that if we remove the alphabet, everybody, the grocery stores will revert to Wednesdays only for discount, and then everybody will go on a Wednesday and defeat the purpose and the aim of the exercise. We expect, in my statement, I mentioned phase 4B. We are expecting an answer from the grocery stores tomorrow as to whether they will continue to keep those 3 days of discounts, and if that's the case, then the alphabet will go away.
Mr. De Silva, as tourism minister, I've seen you with press releases this week. We have a golf tournament and so forth. Royal Caribbean stated that they're canceling cruise operations until October, which essentially means our cruise ship or piece of tourism is done for this year. I know that the unemployment benefit has been extended. And I know it's your job to put on a happy face, but we're facing some dark times. Unemployment will set in. The real impact will occur before Christmas. What do you say to those minibus operators and people when you're looking hopeful about a tourism season that's done for this year, when most of our visitors come from the US and we're looking at millions of people unemployed? That's not counting the cheeseburger cruise ship people, because hotels were empty before COVID.
Well, I agree with you, Ciola. It's been a tough time for many people, and the taxi drivers and minibus drivers are no different. I've had many conversations with all of them, and that's why you mentioned the announcement of the golf tournament. What we're trying to do is look at all the events that we had on tap, any new events we can add, and any of the former events that we did have, like the Bermuda Championships in October, November. It's important that we do keep these on tap, because they will put the very industry that you talk of, is the taxis and the minibuses, to work. You'll probably know, I'm sure you know, that with the championship last year, many of the minibus operators received a lot of work during the week, and taxi drivers did too. So
None.
Pardon?
Right now, they're receiving none.
That's
and
true.
That's likely to continue.
Well, what I'm saying to them is that we are working our tails off to try to get airlift back to the country. We're working and talking to the cruise lines. Every week we have standard call. So those conversations continue to take place as well. So we're going to do our very best to get as many airlines on tap. And the announcement today, I think, is a good one. The fact is that we have a fantastic record with dealing with this virus. And that in itself, I think, is going to make a lot of people want to come to Bermuda.
Thought I have one more question. I really have two, so I'll put it all in one. This week, or I believe last week, you said that there were 13 people who came in on private jets, and since then you've said one case was imported. Is in fact that correct? And the other part of my question is for Commissioner Corpushley. You would be aware during the Black Lives Matter and the gay pride movement, you were very vocal about support and so forth in light of what's happened recently, and this case involving 2 non-Bermudian police officers and a sexual assault, gross misconduct against a Bermudian officer. I know a lot of what's going on happened before your watch, but we know the connotations involved regarding lifestyles and so forth. What do you say to the community that the perception could be that Black lives matter, but gay lives matter more?
Well, it's a very emotive question, and I know where you're coming from. I want to say firstly that any person who is a victim of sexual assault, sexual abuse, irrespective of ethnicity, gender, sexual orientation, is somebody that should be supported. The matters that you refer to are subject to a process now, and whilst you identify the nationalities of those involved, I'm not going to make comment to that. I'm going to go back to my earlier point of we need to establish the facts. But I can say personally that we're committed to support the person that has made the complaint, and we're committed to obviously go through the correct process. And indeed, the officer has instructed a lawyer to go to judicial review against the DPP's decision. So until that's completed, it's very difficult to say anything, as I say, until the facts are actually confirmed.
Out?
What, the officer who made the social media post?
You responded to. Would that officer be subjected to speaking out on behalf of the officer who has been
Well, if you're
assaulted?
referring to social media posts of the officer who was concerned about the behaviour
Yes.
of other BPS officers, that matter is being looked at. I actually support what the officer said. I think they were honest and open. And I'm consistent and have been around issues around discrimination, whether it be sexual orientation, race or otherwise. And that's part of our code of ethics and our standards of professional behaviour. So yes, it is being addressed. And the expression made in the social media, I fully understand where that person was coming from.
So just before you go,
Ms. Batamosi Wilson. What I would say is, as we end our press conference, the first thing I want to say is like to thank the members of the media for their questions via WhatsApp, and that WhatsApp number again, as a reminder, is 5046045. The government of Bermuda has been working over the past 3 months as we have been in the heat of this pandemic to make sure that we are in a good place. With the news that we have 4 active cases in Bermuda, with the news that we are ready to move into phase 4, with the news that we are ready to emerge from a state of emergency, and with the news that we are ready to safely reopen our borders with a strong and stringent testing regime, I think that we are certainly in good stead. I know that no one will ever agree with every decision that we make, but all the decisions of which the government of Bermuda is making is to make sure that the country's best interests can be protected and we can balance the various things of which we have to versus the health of the country, the economy of the country, and making sure we take care of the well-being of all of Bermuda's citizens. I thank you for your attention. I thank you for your work to date, and I look forward to joining you back in your living rooms next week, Monday. Have a wonderful weekend and stay safe, Bermuda. Thank you, Bermuda, and good evening.
As we